Ladies and gentlemen, hello and welcome to my channel once again. In this video I have discussed the draft of NABH 6th edition. What changes you can expect in comparison with NABH 5th edition. The NABH 6th edition draft has been released in January 2024. Here I have given a brief summary of the important changes that can be expected when the final version is released for implementation. What I have given here is only an assumption based on the draft. The final version may be different from the draft. You can expect the 6th edition to have lesser numbers of objective elements, as seen in this comparative chart. But the numbers of chapters and standards remain unchanged. This is a visual representation of the comparison summary between the 5th edition and the 6th edition draft. Here you will see that the total numbers of objective elements in the 6th edition are much less than that in the 5th edition. Also, Chapter 1 of the 6th edition has one less standard, but the 7th chapter of the 6th edition has one more standard. This way, the numbers of standards have remained the same in both the editions. Chapter 1, Access Assessment and Continuity of Care. What are the important changes you can expect here? Change number 1. AAC 7 and AAC 8 of 5th edition have been combined in AAC 7 of 6th edition. 5th edition AAC 7 states that there is an established laboratory quality assurance program. And 5th edition AAC 8 states that there is an established laboratory safety program. Whereas, 6th edition AAC 7 states that there is an established laboratory quality assurance and safety program. Change number 2. A new objective element has been incorporated in AAC 7 of 6th edition. This new objective element is AAC 7C, which states that laboratory participates in proficiency testing and external quality assurance scheme. This new objective element may actually be AAC 7B of 5th edition, which states that the program addresses verification and/or validation of test methods. We will know it only after the final version is released, because the draft does not contain the interpretations of the objective elements. Change number 3. AAC 10 and AAC 11 of 5th edition have been combined in AAC 9 of 6th edition. 5th edition AAC 10 states that there is an established quality assurance program for imaging services. And 5th edition AAC 11 states that there is an established safety program in imaging services. Whereas, 6th edition AAC 9 states that there is an established quality assurance and safety program for imaging services. Change number 4. In Chapter 1 of 6th edition, a new standard AAC 11 has been introduced. This new standard is, the preventive and promotive health services are provided in a safe, collaborative and consistent manner. There are 5 objective elements in this new standard. The salient points covered in this new standard are: implementation of preventive and promotive health care as per the scope of services, promotive and preventive evidence-based and contextual age-appropriate screening for non-communicable diseases, mental health screening and appropriate intervention, wherever needed, evidence-based and contextual pediatric and adult immunization. A multidisciplinary approach in imparting health education on lifestyle modifications. Change number 5. 6th edition AAC 12 states that the organization has an established discharge process. In the 5th edition this standard is AAC 13. A new objective element has been introduced in AAC 12, 6th edition. This new objective element is AAC 12F, which states that the care shall be provided by expanding access to health practices through domiciliary visits, wherever applicable. Change number 6. AAC 12G of 6th edition and AAC 13F of 5th edition. AAC 12G of 6th edition states that the organization monitors the discharge time, sets appropriate benchmarks and makes continual improvement. AAC 13F of 5th edition states that the organization conforms to the defined timeframe for discharge and makes continual improvement. AAC 12G of 6th edition, according to me, is an improvement upon AAC 13F of 5th edition. Chapter 2, Care of Patients. What are the important changes you can expect here? Change number 7. COP1 of both the editions state that uniform care to patients is provided in all settings of the organization and is guided by written guidance, and the applicable laws and regulations. Applicable laws and regulations have been removed from COP1 of 6th edition. Change number 8. 5th edition COP1C states that care shall be provided in consonance with applicable laws and regulations. This objective element is not there in COP1 of 6th edition. The details of this should be available only after release of the final version of the 6th edition. Change number 9. COP10 of both the editions state that organization provides safe obstetric care. The 6th edition has introduced 4 new objective elements. These are COP10E, which states that organization encourages and welcomes the presence of a birth companion during labor. COP10F, which states that organization treats pregnant woman and her companion cordially and respectfully, ensures privacy and confidentiality for pregnant woman during her stay. COP10G, which states that the treating doctor explains danger signs and important care activities to pregnant woman and her companion. COP10K, which states that organizations shall adhere to legal and defined assisted reproductive technology practices. Change number 10. COP11 of both the editions state that organization provides safe pediatric services. The 6th edition has introduced 1 new objective element. This is COP11H, which states that the organization provides for adolescent-friendly healthcare services. Chapter 3, Management of Medication. What are the important changes you can expect here? Change number 11. MOM1. 5th edition MOM1 states that pharmacy services and usage of medication is done safely. Whereas, 6th edition MOM1 states that pharmacy services and medication management is done safely. The word management has been incorporated in the 6th edition. And this change has been reflected also in the objective elements, wherever applicable. Change number 12. MOM9. 5th edition MOM9 states that narcotic drugs and psychotropic substances, chemotherapeutic agents, and radioactive agents are used in a safe manner. Whereas, 6th edition MOM9 states that narcotic drugs and psychotropic substances, chemotherapeutic agents, and radiopharmaceuticals are used in a safe manner. Radioactive agents have been replaced with radiopharmaceuticals. And this change has been reflected also in the objective elements, wherever applicable. Chapter 4, Patient Rights and Education. What are the important changes you can expect here? Change number 13. PRE 3 of both the editions state that the patient and/or family members are educated to make informed decisions and are involved in the care planning and delivery process. 5th edition PRE 3A state that the patient and/or family members are explained about the proposed care, including the risks, alternatives and benefits. Whereas, 6th edition PRE 3A states that the patient and/or family members are explained about the proposed care, including the risks, benefits, alternatives, expected results and possible complications. In PRE3A of 6th edition, the requirements of 5th edition PRE3B and PRE3C have been included. That is why these two objective elements have been removed from the 6th edition. Change number 14. PRE5 of both the editions state that patient and families have a right to information and education about their healthcare needs. The 6th edition has introduced a new objective element. This is PRE5J, which states that the organization has a mechanism to promote patient engagement to enhance clinical outcomes, safety and quality. Chapter 5. What are the important changes you can expect here? Change number 15. In the 5th edition, the heading of the chapter is Hospital Infection Control. In the 6th edition, the chapter heading has been changed to Infection Prevention and Control. Change number 16. IPC 2 of 6th edition states that the organization provides adequate and appropriate resources for infection prevention and control. This is HIC 2 of 5th edition. 5th edition HIC 2A states that the management makes available resources required for the infection control program. Whereas, 6th edition IPC 2A states that the management makes available resources required for the infection control program, including allocation of adequate funds from its annual budget. In IPC 2A of the 6th edition, the requirement of 5th edition HIC 2B has also been incorporated. Change number 17. HIC 3 of 5th edition states that the organization implements the infection prevention and control program in clinical areas. In IPC 3 of the 6th edition, control program has been changed to control processes. Change number 18. 5th edition HIC 3F states that the organization implements the antimicrobial usage policy and monitors the rational use of antimicrobial agents. This is not there in the 6th edition. It may have been incorporated into some other objective element. We will come to know of it only after the final version is released. Change number 19. IPC 5 of 6th edition states that the organization takes actions to prevent healthcare-associated infections in patients. This is HIC 5 of 5th edition. 5th edition HIC 5B states that the organization takes action to prevent infection-related ventilator-associated complication and/or ventilator-associated pneumonia. 6th edition IPC 5B has been changed to, the organization takes action to prevent ventilator-associated pneumonia. Change number 20. HIC 5 and IPC 5. 5th edition HIC 5C states that the organization takes action to prevent catheter-linked bloodstream infections. 6th edition IPC 5C has been changed to, the organization takes action to prevent central line-associated bloodstream infections. Chapter 6, Patient Safety and Quality Improvement. What are the important changes you can expect here? Change number 21. PSQ1 of both the editions state that the organization implements a structured patient safety program. 5th edition PSQ1E states that designated clinical safety officer coordinates implementation of the clinical aspects of the patient safety program. This objective element has been removed from the 6th edition, maybe because objective element PSQ1D is almost similar to this. PSQ1D states that designated patient safety officer coordinates implementation of the patient safety program. Change number 22. PSQ2 of both the editions state that the organization implements a structured quality improvement and continuous monitoring program. In 6th edition, a new objective element has been added. This is PSQ2D, which states that the Quality Improvement Program focuses on appropriateness of clinical care. Change number 23. PSQ 3 of both the editions state that the organization identifies key indicators to monitor the structures, processes and outcomes, which are used as tools for continual improvement. 5th edition PSQ 3E states that the organization has a mechanism to capture patient-reported outcome measures. This objective element has been added to PSQ 4D of 6th edition. Change number 24. PSQ 4 of both the editions states that the organization uses appropriate quality improvement tools for its quality improvement activities. 6th edition PSQ 4B states that the quality improvement projects shall include improvements in patient care delivery and hospital operations, which will have an impact on cost and efficiency. I am presuming that PSQ 4C and PSQ 4D of 5th edition have been indicated in PSQ 4B of 6th edition, because these two objective elements of the 5th edition are not there in PSQ 4 of the 6th edition. Chapter 7, Responsibilities of Management. What are the important changes you can expect here? Change number 25. ROM 1 of both the editions state that the organization identifies those responsible for governance and their roles are defined. 6th edition has included one new objective element. This is ROM 1G, which states that those responsible for governance shall develop clinical governance framework. Change number 26. ROM 2. 5th edition ROM 2 states that the leaders manage the organization in an ethical manner. Whereas, 6th edition ROM 2 states that those responsible for governance manage the organization in an ethical manner. In the 6th edition, the leaders have been replaced with those responsible for governance. Change number 27. 5th edition ROM 2A states that the leaders make public the vision, mission and values of the organization. This subjective element is not evidenced in ROM 2 of 6th edition. Change number 28. 6th edition has incorporated a new standard ROM 3. 6th edition ROM 3 states that management ensures sustainability in hospitals by addressing environmental, social and economic factors from long-term well-being of healthcare system and community. 6th edition ROM 3 has 7 objective elements. The salient points covered in this new standard are: those responsible for governance have to address the organization's sustainability program in terms of environment, social and governance responsibility. Take initiatives towards an energy-efficient and environmentally friendly hospital. Address the organization's social responsibility. Promote staff well-being. Take responsibility for sustainable procurement practices. Ensures financial sustainability of the hospital's healthcare services. Encourage employees to use common and/or public transportation to reduce the environmental impact of commuting and carbon footprint. Change number 29. ROM 4, 5th edition, and ROM 5, 6th edition. Please note, in the 6th edition it is ROM 5, because a new standard ROM 3 has been introduced. 5th edition ROM 4 states that the organization displays professionalism in its functioning. Whereas, 6th edition ROM 5 states that the top leadership of the organization displays professionalism in its functioning. In the 6th edition, the organization have been replaced with the top leadership of the organization. Change number 30. ROM 5, 5th edition, and ROM 6, 6th edition. 5th edition ROM 5 states that management ensures that patient safety aspects and risk management issues are an integral part of patient care and hospital management. Whereas, 6th edition ROM 6 states that top leadership ensures that patient safety aspects and risk management issues are an integral part of patient care and hospital management. Here, word management has been replaced with top leadership. Chapter 8, Facility Management and Safety. What are the important changes you can expect here? Change number 31. 5th edition FMS 2G states that the organization takes initiatives towards an energy-efficient and environmentally friendly hospital. This objective element has been removed from FMS 2 of the 6th edition, because it has been made a part of the new standard ROM 3 of 6th edition. Change number 32. 5th edition FMS 6C states that the procedures for medical gases address the safety issues at all levels. This has been removed from 6th edition, maybe because this has already been addressed in FMS 6B, which states that medical gases are handled, stored, distributed, and used in a safe manner. Change number 33. 5th edition FMS 7A states that the organization has plans and provisions for early detection, abatement and containment of the fire and non-fire emergencies. In the 6th edition, this objective element has been broken up into two separate parts for fire and non-fire emergencies. These are FMS 7A and FMS 7B. 6th edition FMS 7A states that the organization has plans and provisions for early detection, abatement, containment of fire and evacuation in the event of fire emergencies. 6th edition FMS 7B states that the organization has plans and provisions for identification and management of non-fire emergencies. Change number 34. 5th edition FMS 7E states that the organization has a service continuity plan in case of fire and non-fire emergencies. This is not there in 6th edition. This could have been incorporated in some other objective element. We will be able to know it only after the interpretations are made available in the final version of 6th edition. Chapter 9, Human Resource Management. What are the important changes you can expect here? Change number 35. HRM 3 of both the editions state that staff are provided induction training at the time of joining the organization. In the 6th edition, a new objective element has been introduced in HRM 3. This is HRM 3J, which states that staff is trained on information systems, information security, information use and management. Change number 36. 5th edition HRM 9A states that staff well-being is promoted. This is not there in HRM 9 of the 6th edition, because it has been made a part of the new standard ROM 3 of 6th edition. Chapter 10, Information Management System. What are the important changes you can expect here? Change number 37. IMS 1 of both the editions state that information needs of the patients, visitors, staff, management, and external agencies are met. In the 6th edition, a new objective element has been introduced in IMS 1. This is IMS 1H, which states that the organization shall make efforts to use digital health technology to improve operational efficiency, patient safety, and patient experience. These are the 37 important changes that I have identified for you. There are more, which I have not considered very important now, because it is only the draft of the 6th edition. Hope you have found this video helpful. If you have liked the information that I have shared with you, then please like my video and subscribe to my channel. Once again, thank you very much for watching till the end. Have a great day.